How's everybody on this Monday? Running 5960. Hey, Robin, good to see you. Hope everybody is doing well. We have a lot of important stuff to talk about today. I've been doing a ton of research and I wanted to share everything with you. Hey, crazy baby. Please go ahead and share and invite your followers. Hey, Bobby, good to see you. I saw you come in. All right, let me go ahead and tweet this out and invite our Cloud Hub. Hey, Judy, good to see you. Hey, Eleni, how are you? Hey, Sally, Hook, Dawn, good to see you. So as I was telling everybody, I have a lot to talk about this morning. Hey, Avis. So please invite your followers. Wayne, good to see you. I did a lot of research last night. I want to share what I found. I want to kind of separate the conspiracy theory from the true, truly what's happening. And if you will, invite your followers. It looks like a lot of people aren't getting notification and who knows what's going on that they're watching on TV. I'm going to read Psalm 9 and then we'll get started. I will praise you, O Lord, with my whole heart. I will tell of all your marvelous works. I will be glad and rejoice in you. I will sing praise to your name, O Most High. When my enemies turn back, they shall fall and perish at your presence, for you have maintained my right and my cause. You sat on the throne judging in righteousness. You have rebuked the nations. You have destroyed the wicked. You have blotted out their name forever and ever. Amen. I'm going to stop right there. Good morning, Angie. Good to see you. Sharon, good to see you. Monica, hello, hello. All right. So hopefully some more people will come in and I won't have to repeat and they can see it on the replay as well. Good morning, Philium. Like I said, I did a lot of research last night and I kind of wanted to do that because I wanted to separate the fact from the fiction, the conspiracy from, the reality and all that. Let's start with this. Coronavirus deaths in the United States as of today, right at this moment on the in COVID2019.live anyway, that's on that website. Hey, Barbara, it says there are, let's see, 9,664 people that have died so far. Most of the cases coming out of New York. A lot of recovery going on in New York that nobody's talking about. 10,478 people have recovered from a total of 123,018 that were confirmed. Now there's a lot of speculation on, are these people really being diagnosed with COVID-19 because they have it? Or are, like a lot of hospitals, from what I'm reading, they're saying, let's see the exact words here, if I can find it. CDC, this is from the Federalist Papers. Don't know if you can trust them. Take it with a grain of salt. But the CDC is telling the hospitals to list COVID-19 as a cause of death, even if you're just assuming it or it only contributed to it. So there's a lot of things there. We don't know what is actual and what isn't. Also looking over, hey, Noel, at the number of flus as compared to coronavirus and all that. This is an estimate. CDC estimates that from October 1, 2019 through March 28th, there have been between 39 million and 55 million flu illnesses, 18 million to 26 million flu medical visits, 400,000 to 730,000 flu hospitalizations, and between 24 to 63,000 flu deaths. And again, we're not even addressing those. We're just talking about coronavirus. Now, here's some of the things that I want to get into that, hey, Debbie, Susan, good to see you. Sorry, I was away for a second. Gillian, can't open Cloud Hub. Well, Sally, I'm not sure why. I think they're using this to run up the deaths. Okay, here's what I did a lot of going back and looking at a lot of different things. I watched an hour-long video that Dr. Fauci had given a speech back in 2017. Okay, so I listened to the whole thing because I wanted to, from a former attorney and a current licensed therapist, I wanted to get into the mind of Dr. Fauci and listen to and learn about who he is. Hey, Kim, and learn about who he is rather than, like I said, conspiracy theories. Is this a good guy, bad guy, whatever? I wanted to know who he is. Now, this was a video back in 2017. He started talking about the fact that he had been, the specialist, if you will, or expert from Ronald Reagan's time, which we knew. He's been, like 5 presidents. Now, let me just talk about, so you get an understanding of the way this guy thinks. He said under Reagan, hey, Danielle, we should have paid more attention to certain diseases and things at the time, and we weren't doing that. And he brought up HIV AIDS, and he said he first became aware of HIV AIDS in 1981. And in the beginning, they thought it was just an American gay issue, so they really didn't do anything about it. And then they started seeing people get infected in Africa, and they thought, oh, perhaps we have a bigger problem than what we thought. And he said that the CDC was really interested in it, but nobody else really was. So he approached Reagan, and Reagan was like, he was kind of sort of interested, but not all that much interested to kind of do anything about it. So he went to George H.W. Bush, who was the vice president at the time, told him about the fight of AIDS. Hey, Bobby. And so what happened then, that's when they started doing a lot of research, started pouring a lot of money into HIV AIDS. Now, is that because Dr. Fauci is a globalist? I don't necessarily think so. I know George H.W. Bush, I'm pretty convinced, was a globalist. Okay. He just was. But anyway, this is very interesting. The second part of this. Now, this is how Dr. Fauci believes that whenever you have something like AIDS that is huge, on a huge scale globally, there's certain things that you have to do in order to combat it. Hey, Candy. He said, first thing you got to do. Now, see if this sounds familiar to you, because I think you're going to see that it is very familiar. Commit substantial financial and human sources to fight something that's global, like AIDS, all right? Or like, COVID-19. Gather together, get your best and brightest investigators and clinical research sources involved. You've got to involve the community, which, shutting down everything, telling you that, don't breathe on anybody else, 6 feet apart, wear your mask, blah, 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 wash your hands. Got to get the community involved or you're not going to be able to get it stopped. Do a cross-sector collaboration. You can't do it alone was his big thing and way of thinking. Do it with industry, CDC, working with global organizations, philanthropy, NGOs, the private organizations. And you need to get the leaders involved. Okay. What I just read you is exactly what he is doing for COVID-19. Exactly. Almost to the T. So I don't think that he is necessarily this big globalist that's trying to bring the president down or the country. Could be, but it sounds like from a very early age, and I'll get to that in a minute why I say this, he has been involved in infectious diseases. He's been involved with thinking that, no, Judy, it's not. It actually isn't. If you're a doctor and you truly believe this, I think it's very sound reasoning for a doctor to take those steps and want to look at things on a certain pattern, step by step. I think that's reasonable. Now, does it mean that he's right? Does it mean that every time that we have something, we should do the exact same thing? What I'm learning about Dr. Fauci is he's been around since like the early 80s, with Reagan. It's kind of like the difference between using a telephone book, my analogy here. Hey, Jordan, using a telephone book or going into technology and learning how to do it better, faster, more efficient, cheaper, blah, blah, blah. Okay. Hey, John Mott, Timothy, Marvin, good morning to you. So I think he has a pattern that he's always used. And he feels that this is the way that you address everything. Now, he talked about Bill Clinton. And what happened? Well, what happened with Bill Clinton was West Nile and H1N1. That's kind of when that started. So he had the West Nile virus, and he goes, what do? Go back to the basics. Go back to what we've done before. Hey, Dennis and Kathy Olson, good morning. Thank you, Kathy. I appreciate it. And so what did they do at the end of West Nile? They developed a vaccine. He is a big vaccine person, always has been, probably always will be. To him, the way to resolve everything, when you go through all the steps that I was talking about, when you get down to the end of it, you create a vaccine. That's who he is. And he's consistent. It's not like he just started this with President Trump. He's been this way since the early 80s and even before. Now, he talked about George Bush, and he said George Bush was still dealing with AIDS when George came on the scene. But he also had to deal with anthrax, bird flu, and SARS. All of that came under George Bush's administration. And so he said, we thought 9/11 was bad, and right after 9/11, here comes anthrax. And he said what they started looking at were the strategic plans for agents we knew that had been stockpiled by the Soviet Union. So they looked at smallpox, anthrax, and botulism, things that they knew that could be used against them in any type of bioweapon type thing. He spoke with Bush about how to handle I'm calling it bioterrorism. He called it something else, but it means the same thing. And President Bush was at that time more interested in terrorism than he was in any type of bioterrorism. And that's when, again, they started looking at what did the Soviet Union have stockpiled, Haley, that could come back on them and be used. And interestingly enough, right, remember anthrax. That's when we had the issues with anthrax. And Dr. Fauci said at the time, he was so pleased with George Bush because George Bush had come to him and said, what should we do? Hey, Marlene, what should we do? And George Bush, again, was more interested in actual terrorism, right? Not anything bioterrorism, medical, but the actual terrorism. And Dr. Fauci said, if honestly, I'm more worried about natural occurrences of pandemic influenza and AIDS than I am about terrorism. So George Bush at that point enacted what he called PEPFAR. I don't know if it's PEPFAR, and I don't know what that is. That's what Fauci said really quickly. He enacted PEPFAR, which treated people with AIDS, and he said that was the most important global endeavor that has ever been established in history in regards to any single disease. So, as you can see, this guy is really interested in global pandemics, global influenza, and how to treat that. And what he does in order to treat something like that, from what he said, his own words, he throws everything at it. He throws everything at it. Financial was the number one thing he said. You bring together all the financial resources, all the financial human sources. And he's done that again. President's emergency plan for AIDS. That could be it, Alan. And he said also they had the bird flu. And again, the CDC, the end result, hey, Teresa, was that they created a vaccine. He mentioned SARS. He said SARS. Now listen to SARS because this is like deja vu, Groundhog Day. Okay. SARS really scared us. SARS started in China, went to Hong Kong because somebody went to a hotel from China to Hong Kong, and he got on a flight with other people. And those other, I don't know if he got on a flight, but like 19 people got on a flight, and they went to many different places. And as a result, there were 8,000 cases of SARS, and 800 people died from SARS. And he said it almost stopped many of the flights in the airline industry. Hey, Lori, which is exactly what we're seeing now, right? We've shut down basically the airlines, and we've shut down most industry. He said CDC jumped on it with new technologies and developed the SARS vaccine. He never had to use it because the public health measures stopped it and the vaccine was not needed. So in each one of these things, with each president, with each new thing coming up, his goal, again, I'm just reiterating, hey, Renee, is to throw everything at it. Everything you got, work with everybody globally, work with all your best people, get the leaders like Trump involved, get the leaders like in other countries involved, get everybody involved. But the number one thing is financially throw everything at it you have. So why is he so against the use of chlorine with respect to COVID? Patrick, that's easy. Because everything that he's done it was done after research. Every vaccine was done after research. Hey, Aussie Nick, he is a doctor, who is anal, it seems, about getting this research done with specific data before you follow through on a vaccine. So he's not, none of the things that I could find was he willing to go ahead and just throw medicine at it, but he was willing to get a vaccine after all the research was done. Now, he said, now listen to this. This was scary. This, again, was back in 2017 when he was doing the speech. He believes what is needed is a universal vaccine to fight pandemics and the seasonal flu. Again, this guy is the poster boy for vaccines. That's his answer to everything, is a vaccine, so that we don't have any more of these things, so that we don't have to go through all these steps that he's recommended. We just give a vaccine, one size fits all. And what he likes to do, he likes to find out things before they happen. So he likes to look at things and plan ahead of time of what kind of pandemic is coming next, so they can start working on a cure now, and that cure ends in a vaccine. Now, he talked about Obama, and that's when Ebola came out under Obama. Good morning, Robin. And he said, remember what was so difficult about Ebola, why people were so scared, is because we were talking about Ebola in Africa was very crowded, no good healthcare system. They were skeptical on authority. You don't understand how, yeah, okay. Thank you. And you do. Thanks a lot. So anyway, Yike's not a fan of flu shots. I don't get that. Well, Susie, neither do I. So anyway, he said they set up special Ebola units in the NIH, that's the National Infectious Disease, healthcare type stuff. And we trained considerably for how to handle Ebola. He was one of the people that when it came to America, he was he was all suited up and he was going in treating patients, and over in Africa as well. He said in the developed world, when we have the capabilities of taking care of people that are desperately ill based on the training Fauci and others have, we had two teams. So he had a infectious team and a critical team, and they were only allowed to work so many hours before they had to rotate and get out and bring in new people, because it was so hot in Africa, and Ebola just kept the infection going. He talked about Zika, it not being a new virus. And he said, because we should have seen Zika coming, because there was seen in France in 2013. And he goes, and then there was a perfect storm when it went to Brazil, very populous country, and there was an outbreak. And he said, now we have vaccines. So everything is a vaccine. He said two approaches to vaccines: develop universal platforms that we're doing with vaccines and other platform technology. You don't have to go from scratch. Good morning, Lori Perkins Bailey. And Keith, good morning to you. And he said, implement what we have learned and how we handled the AIDS epidemic. And he said one of his things that he would love to see, and this was in 2017, he said, we need a public health fund set aside. So see, he wanted a big fund set aside so when a pandemic hit, they'd have the money. Good morning, Lynn. Lynn, you'll want to go hear the replay. A lot of stuff I've just been talking about. And he said, history has told us what will happen, and this is how we should handle it. And Robin Gailey, please go back and listen to the replay, because there's a lot of things I've been talking about that you really need to hear. Now, I want to talk a little bit about some events that have taken place, and of all the people, some of the doctors like Fauci and Birx, from what I'm looking at, I want to say that based upon their education, their experience, what they've been taught, what they believe, I really do believe that they believe what they're saying. And they believe that the knowledge that they have is why they do what they're doing. I'm sure he does, but doesn't want to stamp a vaccine without educational research. That's right, Ruthie. That's why he's not moving on it right now. Maybe you can give us some insight about Shiva someday. I've been watching him a little lately. Yeah, Susie, I will talk about him someday. I'm listening to what he has to say. I think his theory about the immune system is correct. Okay, so I don't necessarily, are they globalists and that's why they're trying to do everything? I think if they are globalists, they were born and raised into it. I don't think they just came on the scene and said, let's take over the world. This is something, again, that he's been doing and Birx has been doing for their whole careers. So I don't see it as a plot, but let me talk about some things that I do see that kind of really bother me. We've kind of mentioned it. We've never really talked about it before. And that was the October 2019 Event 201. Event 201 or 201, whichever. That was when the Johns Hopkins Center for Health Security went in partnership with the World Economic Forum and Bill and Melinda Gates Foundation, and they hosted 201, a high-level pandemic exercise on October 18th, 2019. Hey, Sherry, good to see you. And hey, Linda Smith. Robin, let's get back to that. Now, one of the things that I find interesting, it says the exercise illustrated areas where public and private partnerships, again, listen to this, where public and private partnerships will be necessary during the response to a severe pandemic in order to diminish large-scale economics and societal consequences. Again, they're using that same premise that Dr. Fauci cited in his 2017 video and what he used way back when during the Reagan administration when he was dealing with AIDS. I find it also interesting that a lot of our data that's coming out right now is coming from the Johns Hopkins Center. And here they are involved in the pandemic. Don't know what that means. Don't know if it's good, bad, or indifferent, but I'm just telling you the connection. Managing these events already strains global capacity, even absent a pandemic threat. Experts agree that it's only a matter of time before one of these epidemics become global. A pandemic with potentially catastrophic consequences, a severe pandemic, which becomes Event 201, would require reliable cooperation among several industries, national governments, and key international institutions. Again, the same pattern. There's consistency there. Whether you like it or dislike it, there is consistency. Now, here's this, though, the scenario. I don't know if anybody looked into what the scenario was for Event 201. The scenario, to me, is pretty coincidental to what we're seeing with COVID-19. So let me read to you what they're saying here. Event 201 simulates an outbreak of a novel zoonotic coronavirus transmitted from bats to people that eventually becomes efficiently transmissible from person to person, leading to a severe pandemic. What have we been told? Bat soup, and that's why that it started in Wuhan, China, because they were you drinking, eating whatever, bat soup. And so this just happens to be the simulation, bats to pigs to people. Now, The pathogen and the disease it causes are modeled largely on SARS, but it is more transmissible in the community, setting up people with mild symptoms. I mean, we have that right now. This is the scenario that they put forth is exactly what's happening right now. Now, he says here, their scenario, disease starts in pig farms in Brazil. Maybe that's because that one we were talking about, SARS, that seemed to be happening when it hit Brazil. That's when it got, Barbara, I know it's a rumor. I got that. That's what I said, that they want us to believe that. Thank you, Gary. Thank you. Gary says, Susan, you're on point. So they're using the same SARS scenario that happened in Brazil, and they're using that here. Quietly and slowly at first, but then it starts to spread more rapidly in healthcare settings. When it starts to spread efficiently from person to person in the low-income, densely packed neighborhoods of some of the megacities in South America, the epidemic explodes. It is first exported by air travel to Portugal, the United States, and China, and then to many other countries. And then the next thing is there's no possibility of a vaccine being available in the first year. There is a fictional antiviral drug that can help the sick, but not significantly limit the spread of the disease. Now, come on. Is that a coincidence? Or do they know that viral drug, the antiviral drug, the Z-Pack, let's just call it that, it's so easier to pronounce. Did they already know about that? I'm guessing, yeah, they did, because they knew about the malaria pill. They knew about some of the things, and they knew how it worked on certain diseases. Now, they put in here, since the whole human population is susceptible during the initial months of the pandemic, the cumulative number of cases increases exponentially, doubling every week. Are we not seeing something similar to that? Yeah, well, Ron, nobody does that accidentally. The scenario ends at the 18-month point. Remember, they were talking about this might end in about 18 months, or we might see it next year again seasonally, with 65 million deaths. That's the scenario. The pandemic is beginning to slow due to the decreasing number of susceptible people. It will continue at some rate until there is an effective vaccine, or until 80 to 90% of the global population has been exposed. From that point on, it's likely to be an epidemic childhood disease. That scenario back there in October 2019 almost fits to a T, in principle at least, what they're dealing with right now in the coronavirus. Is that a coincidence? Is it something that they've been fearing for a long time would come? Hey, Barbara Ryan, what is this report? This is a report that, let me see, where did I get this? This was the October 29 Event 201, Gillian. Now, something else came out yesterday that I don't believe, but I believe it was kind of, in some ways, they put it out so that maybe we would say, oh, so maybe there is some merit to the bat soup in China deal. There is a tiger at the Bronx Zoo that is tested positive for the new coronavirus in what is believed to be the first known infection in an animal in the USA or a tiger anywhere, federal officials at the zoo said. A 4-year-old Malayan tiger and 6 other tigers and lions that have also fallen ill are believed to have been infected by a zoo employee, according to the U.S. Department of Agriculture. The first animals started showing symptoms March 27, are all expected to recover, and the zoo, closed to the public. They said, we tested the cat out of an abundance of caution and aim to contribute to the world's continuing understanding of this novel coronavirus. The finding raises new questions about transmission of the virus in animals. The USDA says there are no known cases of the virus in U.S. pets or livestock. Jim said, I am skeptical. Yeah. It's important to assure pet owners and animal owners that at this time, there isn't any evidence that they can spread the virus. Now, there are diseases that are passed from animals to human. Animals pass the virus among other animals, not animals to human. Like the feline leukemia from, cats to humans. There are some indications. I don't think this is one of them. I think that would be very unlikely, but why not? Why would you test an animal at the zoo? Exactly, Jim. Now, Bill Gates is surfacing back up. Hey, Shaw Cobb and Tia. He warned 5 years ago that the world's greatest threat was a pandemic. He believes that the current coronavirus crisis is a nightmare scenario, but said social distancing and a strong national response can keep casualties low. And he said, this is a projection Trump made. No, it's not a projection that Trump made. It's a projection that Fauci and Birx and people like that told Trump, and he repeated it. Trump referenced a projection that the U.S. would see between 100,000 and 240 deaths from COVID-19 before the outbreak is under control. It's a nightmare scenario because human-to-human transmittal respiratory viruses can grow exponentially. And if we had kept on working, going to work, traveling like we were, that curve would never bend until you had the majority of the people infected and then a massive number seeking hospital care and lots of deaths. We'll never know if that's true. We know that that's the model of Dr. Fauci. Why would a zookeeper get that close to a tiger? Lynn said. Well, Lynn, no, never mind. Gates did suggest, however, that the response should be national. So we have Gates. Gates, a globalist. He is a globalist. He's always been one, and he always will be. Tammy said Gates wants one world order. Oh, while we're at it, let's go ahead and retweet. We're at the halfway point. I mean, I don't know how we got here that fast, but we're here. Retweet this quickly, and then we'll go forward. Okay. Again, he wanted he wanted the president to come out and shut down all the states. And again, why is that bad? We have a little thing called the Constitution that's really not being followed all that much right now. But we have the Constitution that says, the federal government shouldn't come in and tell the states what to do. And so there you go. The president's trying to maintain the Constitution, whereas everybody said, oh, well, the president, he'll get rid of the Constitution. No, he won't. He's enforcing the Constitution. Let's see. In the Washington Post published last week, Gates called for a national shutdown and more testing to quickly identify potential volunteers for clinical trials and know with confidence when it's time to return to normal. During a TED Talk in 2015, Gates warned that we're not ready for the next epidemic, but offered hope by saying we can build a really good response system to prepare. His suggestion including setting up a medical reserve corps to be paired with the military. Funny that we're using that now in New York. And germ games, similar to military war games that could be used to run simulations. Between 2015 and 2020, less than 5% of what should have been done was done, Gates told Chris Wallace. Gates did note that the current pandemic isn't the worst case, given the relatively low fatality rate compared to diseases like smallpox. So this is super, super bad, but we will eventually get a vaccine. Okay. So vaccine. Now, in a press release, I found a press release back in 2009, and I wanted to go over that press release. Global health leaders launch decade of vaccines collaboration. Bill and Melinda Gates Foundation, Melinda. Who is involved? Okay. The World Health Organization, UNICEF, and the National Institute of Allergy and Infectious Diseases. And that's where, hey Gina, and that's where Dr. Fauci comes into play. Now, let me just take some water first. Okay, so the NIAID, that's the National Infectious Allergy and Infectious Diseases, and the Bill and Melinda Gates Foundation have announced a collaboration to increase coordination across the international vaccine community. And create a global vaccine action plan. This plan will build on the successes of current work to achieve key milestones in the discovery, development, and delivery of life-saving vaccines to the most vulnerable populations. The structure of the Decade of Vaccine Collaboration includes a leadership council. Dr. Fauci was part of that leadership council, and a whole bunch of other doctors as well. One of the people there said, vaccines are miracles. For just a few dollars per child, vaccines prevent disease and disability for a lifetime. We must make sure that people understand that vaccines are one of the best investments in health. And so this collaboration followed the January 2010 call by Bill and Melinda Gates for the next 10 years to be the decade of vaccines. So I guess this press release actually came out in 2010, not 29. The Global Vaccine Action Plan will enable greater coordination across all stakeholder groups, national governments, multilateral organizations, civil society, the private sector, and philanthropic organizations, and will identify critical policy, resource, and other gaps that must be addressed to realize the life-saving potential of vaccines. Part of the Leadership Council, Dr. Margaret Chan, Director General of WHO, Dr. Anthony S. Fauci, Director of NIAID, part of the National Institute of Health. So as you can see, way back when, even in, under, who was that? Obama, Fauci was still working with all of this. And here's what the National Institute of Allergy and Infectious Diseases conducts and supports research to study the causes of infectious and immune-mediated diseases and develop better means of preventing, diagnosing, and treating these illnesses. So he was involved in doing all that. Now, Dr. Birx, little bit about her. She was appointed by Barack Obama to serve as the ambassador at large to the global AIDS coordinator. So Fauci and Birx, their whole background really was in infectious diseases, but mostly with AIDS, working with AIDS. She worked from 2014 to 2020 doing that. She was the United States AIDS coordinator in 2014. She graduated from the Pennsylvania State University Medical School in 1980. She was issued a medical license in Pennsylvania in 1987. And yeah, I know about the patent, Linda. She was also a colonel in the U.S. Army. So I don't know if you knew that about Dr. Birx, but she was a colonel in the Army. She has published over 220 manuscripts in peer-reviewed journals, authored nearly a dozen chapters in scientific publications, as well as developed and patented vaccines. She received her medical degree, again, Pennsylvania State. She was at the CDC from 2005 to 2014. In 1985, she began her career with the Department of Defense as a military-trained clinician in immunology, focusing on HIV/AIDS vaccine research. From 85 to 89, she served as an assistant chief of the Hospital Immunology Service at Walter Reed Army Medical Center. Through her professionalism and leadership in the field, she progressed to serve as a director of the U.S. military HIV research program at the Walter Reed Army Institute of Research from 1996 to 2005. So again, the common denominator, yes, Judy, vaccines. The common denominator is also that their AIDS, HIV/AIDS. These people have developed a program, if you will, on how to deal with things based upon their knowledge of HIV/AIDS. Now, it may be a good model. It may not be so good. It could be outdated. It could be that their model, while maybe good back in the day under Reagan in the 1980s, needs to be updated. For example, here's what I mean by that. What about the fact that instead of using different things, let's run a computer model, okay? And let's run a computer model to see what we have, rather than maybe all and out coming out at the very, at the start going, okay, we need to stop everything. We need to throw everything financially at it, et cetera, et cetera. In this instance, should there have been more computer modeling? And they kept saying, well, we've done some of that, but we don't have the right stats. Well, why not? Because, China lied, for one. But could there have been other models that they should have or could have used that they didn't use? Now, again, some of the models that they use came from the Institute for Health Metrics and Evaluation. Let me tell you a little bit about what I learned about them. They're a research institute working in the area of global health statistics and impact evaluation at the University of Washington in Seattle. Where do they get a lot of their money? Bill Gates. Bill Gates. All right. Now, their goal, as stated on the Institute's website, is to identify the best strategies to build a healthier world by measuring health, tracking program performance, finding ways to maximize health system impact, and developing innovative measurement system. IHME provides a foundation for informed decision-making that ultimately will lead to better health globally. They gather health-related data from all available resources. So if you did that from all available resources, did you really do that? I mean, did you go and look at just the model from, China, especially, maybe a little bit of Italy and blah, blah, blah? Or should you have been gathering information? Because look at it this way. They've been talking about pandemics, at least, Fauci has, since Reagan. Shouldn't they have been gathering information all along about how AIDS reacted, how SARS reacted, how H1N1, how the bird flu, Zika, Ebola, and all of those things? Did they gather that information to get a good idea of how things were going to react? Now, IHME was launched in June 2007 based on a core grant of $105 million, primarily funded by the Bill and Melinda Gates Foundation. Among its earliest projects was to produce new estimates of mortality rates, which were published in well, it doesn't matter. Blah, blah, blah. Okay, so in 2017, did they trust the data from other countries all these years? Exactly, Judy. In 2017, the Gates Foundation provided IHME with another $279 million grant. Big picture is they want population control. Thanks for the link for Linda. So basically, all right, we have now Bill and Melinda Gates would say to you, the reason that we're doing all this is because we found that children in poor countries don't have the same benefit to life and be able to reach their goals and all that, because they live in poor countries. They're not getting the right health benefit. They're not getting anything else that the rest of the world has. And so we need to do this in order to make sure that they have a good life and they can be the best they can be, right? So the way to do that is to do all of this research and not our problem. Agreed, Judy, but I'm giving you the reasons that they're saying it. So this is why he wants to vaccinate everybody. He wants to vaccinate the world globally so that everybody will be on equal footing. That's what I've learned from looking at, I went and looked at Bill Gates and Melinda and the way they think about things and how they approach things. I looked at, as we've heard, if anybody came in late, you really need to go back and listen to the replay. The people in poor countries have survived this long. Oh, yeah. But Alan, couldn't it be so much better if we all just stepped in and changed things, right? We transformed things. So that's why Bill and Melinda Gates would tell you why they're doing and pushing vaccines like they do. So we'll be on an equal playing ground. That's why they're probably talking why quantum dot tattoos, why that's so necessary, because we want to implant something. I believe it's in your right hand, or is that just 666? But anyway, implant that so that we will know that you've been vaccinated. We will know eventually, perhaps, that if you haven't been vaccinated, you can't buy or sell in public, right? Because we need that tattoo. And that's also why Bill Gates is doing ID 2020. Yeah, wouldn't we all be equal? So everything is doing everything to bring everybody down, if you will. And I say down. Yeah, RFID chip. That's right. Testimony. Hey, Garrett, like cattle. So they want to, and they're treating us like cattle. If recently you haven't seen the Google tracking of your telephone to tell people where you're located so they can see if you're in compliance with all of this going on now, telling you to stay at home, Google is already, and the technology is already there. So, so Dr. Fauci too, he's talking about history tells us that we shouldn't be surprised that in the next few years with emerging diseases that we're going to have pandemics, that we'll always have them. Back on January 21st, Fauci was on Newsmax. He told his interviewer then that he did not think that the corona outbreak was a major threat to citizens of the United States. Okay, what begs the question here is you had all this research, Dr. Fauci. You've been doing this since the 1980s. This was your perfect moment to go and tell everybody, we don't know what we have here, but maybe we better take a look at it because we've seen this before. The Lord has power to cause plagues only, testimony said, over on D Live. So what it was kind of contradictory to what he's always been. Why is that? I don't know. Did he miss the mark? Did he rely on information that was faulty? Was there no information? Was China hiding everything so he couldn't get the right information? I don't know. What I do think is that although we're seeing a sort of a leveling out, some places in California are even ramping things up. In some counties, it now requires you that if you're even outside jogging, you have to wear a face mask. Yet everyone has forgotten it was Fauci who said these things. Yeah, well, and that's why I wanted to go over everything that I learned in doing research last night and listening to that hour-long video of Dr. Fauci. It helps me to understand more about where they're coming from. And Carol's talking about Dr. Shiva. Yeah, you know, I'm with Dr. Shiva. I like a lot of things that he's saying. I'm also with President Trump. We got to open the country back up. Do I think that the country should have been shut down? No, I really don't. I think in a lot of respects, we should have isolated, if you want, those that were infected. We should have protected the ones that were most at risk. And I think a lot of people should have gone on and done their daily routine. Now, one other thing really quickly, and I want to read something if I can find this. You know, everybody is trying to make it out like President Trump, at least during this, yesterday during this conference, President Trump is like, you know, we need to get this Z-Pack drug out there. There is an LA doctor, Los Angeles doctor. He said that he's seen significant success in prescribing the malaria drug hydroxychloroquine in combination with zinc pack. He said, Dr. Anthony Cardillo, whichever way you want to pronounce it, said has seen very promising results. Every patient I've prescribed it to has been very, very ill, and within 8 to 12 hours, they were basically symptom-free. Nothing supports a shutdown, nothing more than a global takeover, and Trump is on it too, Judy said. He said, why? Because they don't want him to be, I think they don't want him to have it because they don't want him to be right. Now, Paul Sperry, who is he's a journalist on the conservative side, back on March 20th, he said this. Chloroquine is so safe to use that the CDC has already been recommending prescribing it to even small children and pregnant women to take in COVID-19 size doses, even before traveling to areas known for malaria transmission, including Central America and the Caribbean. So basically they were saying, he told Laura Ingraham he's treating Hunter. Yeah. So basically the media Thank you, Gary. The media is trying to make it look like here's President Trump pushing a drug that he knows nothing about, that isn't approved by the FDA, when it is, because they just approved it. And President Trump saying, look, it's a malaria drug. They've been using it forever. You know, Paul Sperry's saying that too. CDC prescribing it to children. CDC knows that children are taking it. What CDC doesn't know, maybe 100%, is whether or not it's effective. But what they do know is it won't kill you. Just like President Trump said, it won't kill you, so try it. So why won't they try it? Well, my theory is a lot of things. Number one, you've got Fauci and Birx, especially Fauci. They want to do long tests and research to come up with a vaccine, which they will do for this. They will come up with a vaccine, but that's their MO. That's how they handle everything. You just keep going along until you get that vaccine. They don't want a pill, because if you get a pill that works, they're not going to have to do the vaccine. Hey, Sal, how are you? Sally, I trust POTUS, not Fauci. So do I, Sunshine. So do I. And especially after looking at everything, I know that is Dr. Fauci's mindset. Again, is he evil? Is he a globalist? He could be a globalist because he's always been. Is he evil? If he is evil, he's been evil since the 1980s, because he's doing exactly the same thing that he's done in the 1980s. So, but how much more we need to be praying for President Trump, because he has the wolves out. Yeah, President Trump. Yeah, and you can't sue for a vaccine. That's right, Mary. Didn't Obama make it where you couldn't sue for the vaccines? Trump is under grave attacks by the enemy of the Lord. Yes, testimony, he is. Fauci is a puppet. I don't know, Kim, if he's a puppet or if he believes in what he's doing. He believes it. You can't be a puppet and be, a puppet is Biden. Biden just, he doesn't even know he's on the earth right now. And he just goes along with whatever they tell him to do, because he's not really cognizant. Fauci believes what he is telling you. He absolutely 100% believes that this is the way to handle everything. He's consistent. He does. He believes it. And so does that make him evil? I don't think so. Like I said, if he's evil, he's always been evil, because he believes this. He's doing, again, he's old school. He's doing exactly what he did in the 1980s. Is there a better way to handle it? Probably so. Is Fauci a medical doctor? Yeah, Fauci is a medical doctor. Fauci's a doctor. Democrat, Tavia, okay. There's a difference between a research doc and a patient-centered doc. Well, yeah, I mean, yes, one's been, but remember, Judy, he was right there on the scene with Ebola. He was treating patients with Ebola. His approaches are outdated, Judy said. Yep. Yeah, Gary. I mean, you can always go to D Live anytime you want, so because you can see everything that is being said. So much money and time and lives will be saved by simply distributing the Z-Pack. Yeah, I'm great, Nimi 8. How are you? So here's the thing: we've got to get the country back open. We've got to get the Z-Pack out to people and at least try it. And we've got this. President Trump now is talking about another stimulus package, and he's all for that. Now, maybe we do have to do that because of the shape that we're in. We've got 10 million unemployed. We're so far down in the hole. Can we get back? Was all of this necessary? I don't think so. I honestly don't. I'm not a doctor, but I also have common sense, and I can do research, and I can look at things realistically and rationally. Miss my favorite barbecue restaurant. The prophet Jeremiah Johnson revealed that Fauci is the rat in the White House. No, I don't. First of all, I don't believe in any prophet named Jeremiah Johnson. But anyway, let's see. President Trump said they have 29 million hydroxychloroquine pills available. So doctors should start using them. And again, I think when President Trump has some time, and if he ever gets time again to breathe a little bit, then he will be able to go back and look at this and go, maybe there's a better way to handle it. Now, I know I didn't do a Bible reading today. I may try to come on later to just do a Bible reading, because we absolutely need to continue to pray. Why do I say that? Because I feel that sometimes we uncover some of these things. Like I researched last night for hours because of the fact that God is leading us. God is opening things up. God is showing us things. And, hopefully God will continue to show President Trump a lot of things. And the end time is nearer. Absolutely. This is leading to a vaccine. Whether this vaccine will be, whatever it is this a takeover? Is it going to be mandatory? I have some concerns that it will be. But what I know is this: God is in control. What we need to do is focus on what it is that we are put here to do. Thank you for your work. Thank you, Barbara. And not worry so much about what everybody else is doing. Everybody, even Fauci, is playing his part in what God wants him to do or is allowing him to do. And so is the president. And right now, for me, President Trump is probably the only person in politics in the White House that I trust. And do I put 100% faith in Trump? No, because he's a human being. That's good, Terry. You can stop listening to me because I don't believe in any prophet named Jeremiah Johnson. Sorry. I believe the prophets of the Bible, but that's where it is. And you can stop listening. That's just fine. So anyway, there you have it. What about Vice President? Sherry, the Vice President has done nothing to tell me or to show me that he can't be trusted. So until he does, I trust him a little bit less than I do. Yes, Jules, Bible Prophets Only. I trust him a little less than I do the president, only because I do trust him, but I have less trust in him because I've seen more of what President Trump has done. I love it that Trump is doing the best to keep us on a positive outlook. Yes, Kim, as a leader, that's what he should do. What exactly are people's hang up with Pence? I don't know. The alphabet thinks that he's going against the president. I've seen nothing. Yeah, I know Jeremiah Johnson was a TV character. Exactly. So yeah, I've seen nothing for Pence to tell me he can't be trusted. But again, it's been President Trump that's been out in the forefront. That's why I trust him most. I've seen everything that he's done. Haven't seen everything that the vice president has done, but I have no reason to believe that he's done anything wrong or is in any way trying to harm the president or anybody else. Just like with the first lady and second lady, I trust them. Do I put 100% faith? No, because I don't know them. Never have seen Pence do anything that's wrong. Never have either, Kim. Not one thing. So again, it's only because I haven't seen him as much. That doesn't mean he's not trustworthy or that he shouldn't be trusted 100%. Pence's background is what they're suspicious of. Yeah. And I don't have any reason to believe, that he's going to do anything against the country. I haven't seen it. So anyway, if you would please, people need to quit paying attention to bots and the letter crap. Yes. Yes, Judy, that would be good because right now everybody's believing that this is all being done so that we can gather up all the pedophiles and bring them to justice. I don't think so. Okay. That's not what I'm saying. If you know something else, that you've got some factual information, please let me have it. Because I don't see that. I see Tom Hanks back in the USA. He hasn't been arrested like the letter said he was going to be. So if you will, please retweet this and share this with everyone so everybody can see it. Have a great day, everybody. God bless you. Take care. I'll see you again soon. All right, everybody. Thanks so much for coming on.